The Oklahoma Department of Veteran Affairs is facing the same issue as many other healthcare providers do, a lack of nurses. Taylor Jackson joins us with more on how the agency tasked with caring for our veterans is working to solve the solution with pay raises. Taylor?
Jason, this raise will provide staff with an average yearly increase of $12,385 per nurse.
Jesse's passing pills. Chuck has gone that way.
Nurses working for the Oklahoma Department of Veteran Affairs will soon receive a much-deserved pay raise. The agency's administration hopes this will help retain staff during the national nurse shortage.
We were pleased to announce across-the-board raises for our nurses. So that was our LPNs, our RNs, our advanced registered nurse practitioners, and our physician's assistants. And it's on a scale that this agency has never seen before.
Deputy Executive Director Sarah Lane says the department launched multiple initiatives to increase benefits for their nurses.
We're very excited to do all that we can for our hardworking staff and especially our nurses. So over the last year, we've built various incentive programs to show our appreciation and to try to creep our compensation up to match that of industry.
Incentives include student loan repayment and referral initiatives.
Referral initiatives where an employee in any trade can refer another employee, and they each get an incentive when the employee reaches the 6-month mark of tenure. We've also done training incentives for advanced certifications because we want to attract the very best in the industry to care for our veterans.
This comes as hospitals and nursing homes suffered staffing issues during the COVID pandemic.
Your residents, which are truly family members, because you get such a close bond with them in a nursing center. But you go from, 150 down to 60. You've lost all those people. It drove a lot of nurses out of nursing, I honestly feel, because it was so mentally hard, physically hard. It was like losing a family member every day.
Come on, baby. He wants chocolate pudding.
Come on.
Rita Owen is the Dementia and Alzheimer's RN Unit Director. She lost more than 20 staff members during the pandemic.
We had a huge turnover rate as well. There was very few of the older ones that stayed after the first round of COVID came through.
Angela McDougall is the Director of Nursing at the Norman Veterans Center. She's been a nurse for more than 20 years and recently came to the Veterans Center in Norman from a private sector due to the benefits that Oklahoma Department Veteran Affairs offers.
I've always wanted to work with the veterans. That's always been, military has always been had a special place in my heart. But to be honest, it was the benefits that we get here. We have a wonderful, wonderful benefits program.
Owen says this raise will assist staff with the higher cost of living due to inflation.
It's taken a lot to buy groceries, buy gasoline, pay our utility bills. So it was a welcomed relief.
Both Lane and Owen believe the additional compensation will attract new staff.
I'm hoping to hopefully get some of our quality people back that are committed to these guys, because it's so important for them to have regular staff and regular committed staff.
Currently, our raises that were announced are going to benefit 210 nurses at our Oklahoma State Veterans Homes. I know that we have in excess of 100 vacancies, and so we're looking for talent at all 7 of our locations.
The Oklahoma Department of Veteran Affairs is grateful for support from the legislature.
I just wanted to really thank our legislators who appropriated funding to us specifically for this purpose, because that's also made this possible. We've awarded $2.6 million in raises, and $1.276 million of that came from an appropriation for that purpose.
The staff I spoke with at the Norman Veterans Center say this job is rewarding not because of the pay, but because they get to serve America's heroes every day.
When they have no one to be there and you are that person and you walk in and you see them light up, it's the best feeling in the world.
At the end of the day, I still feel good that I've made some kind of quality of life for my patients and as well as my staff and their families.
The Oklahoma Department of Veteran Affairs says the projected effective date for the raise is August 28th.